now we invite Dr. Amlin Madam. So she will join from Delhi regarding her session on the National Registry for Rare Diseases. So welcome to you, ma'am.
Thank you so much, and I thank the organizers for having me in this workshop. In fact, it's a very, very important workshop for the patients of the rare diseases, and I would like to present the work that ICMR has been doing and how we wish to progress in collaboration with the Ministry of Health and Family Welfare in this area. So I'll be sharing my slides. I hope the slides are visible.
Yes, ma'am, visible and moving.
Okay. Yeah. So, yeah. So I am Dr. Amlin. I'm a pediatrician and a scientist from ICMR, and I also coordinate the National Registry for Rare and Other Inherited Disorders, which is currently under project mode of ICMR. And soon we are planning to merge the registry with the rare disease program of the Ministry of Health and Family Welfare. So again, I'm happy to join the sensitization workshop on rare diseases. And yeah, so rare diseases are not rare in India. I've been multiple times, I've been saying this in many workshops and seminars, because it is expected that an upward of 76 million Indians are affected by rare diseases, which makes it a sizable number and which has led to this realization by the government of India that now we need to do something more for these patients. So this realization of the plights of rare disease patients has been a relatively recent one by the government, and discussions around formulating a policy of rare diseases and formation of registry initiated side by side. So first policy on rare diseases, national policy for rare diseases, was initiated came into picture in 2017-18, and it statedly mentioned that without any data backing, it's very difficult to form a policy. So at the same time, ICMR also started its activities for formation of a registry on rare diseases, and a letter of intent was floated, and we received responses from centers across the country, and the registry was initiated with participation from 21 centers initially, and all the centers together had the difficult job of identifying which rare diseases to report from the hundreds of the around 7 to 8,000 rare diseases which are present and identified globally. Because we are a resource limited country, so how to spend resources efficiently on rare disease patients within the given budget, meager health budget that we have. So this challenge was posed before us, before the I joined recently, and the centers who had formulated rare disease registry, they had this challenge of identifying the rare disorders. So it was decided the registry will be a general registry which would report multiple disorders and which would be relatively commoner and would have a treatment and or some treatment to support the patients. So such disorders were included in the registry at its inception, and then the protocol was formulated, case record forms were made in discussion with all the sites. The registry finally initiated in the year 2019, and at present about 15,350 rare disease patients are registered in the registry. So the registrations in the registry are presently being done at 24 centers in the country, and only diagnosed patients with the rare diseases which are reported under the registry, I'll show the list in subsequent slides, can be enrolled in for the registry. Then the registry collects a demographic, clinical, and laboratory data of these patients. We have formed a network of patients, families, and clinicians under the registry and hope to improve that process. And we have established a patient database for researchers and policy makers, and we'll soon make it available for some of it for public viewing and some through request. And we also hope to support research on genetic, molecular, and physiological basis of rare diseases through the registry. So these are the centers which are reporting to the registry at present. These centers include all the 12 centers of excellence that have been identified. I think barring one or two recent additions, all centers of excellence are there now reporting to the registry. So the kind of data that is collected in the rare disease registry is socio-demographic data, specific types of rare disorders, family histories, history of consanguinity, then clinical profile of the patients, then diagnostic details, the treatment they are receiving, the genetic profile of these patients, and quality of life indicators for some of the rare diseases. At present, we have 213 different rare diseases which are currently reported in the registry, and the patients enrolled in the registry represent 28 states and 8 union territories. So I was talking about the groups of rare disorders. So on the basis of the origin, the disorders are divided into 6 groups for the purpose of reporting under the registry. So these are storage disorders, lysosomal and glycogen storage disorders, then small molecule inborn errors of metabolism, hematological disorders, skeletal dysplasias, primary immune deficiencies, and neuromuscular disorders. The recent numbers of these patients under the registry are mentioned underneath. And below that, some common diseases which are currently observed in relatively higher frequency are mentioned in these boxes underneath. So we had some important realizations with the registry. One of them was that the gender-wise distribution of the patients was very male-dominated, which implied that the care-seeking behavior of the patients with rare diseases, as also seen in other arenas, is also gender biased. So this data was shared with the ministry, and they now have accepted to sensitize and implement in their program the importance of realizing and mitigating this gender bias in care-seeking behavior for rare disease patients. When we look at the age-wise distribution, we see that about 82% or 83% of the rare disease patients are still children, which is an important implication for the general physicians and particularly pediatricians, because now they are the ones who are going to see a lot of rare disease cases, and then they need to collaborate and manage these patients with various other specialties like gastroenterology, orthopedics, etc. On the right side, you see a map with various shades of red. So this is a map depicting the residences of the rare disease patients who have been enrolled in the registry. So the darker areas show the states where the frequency of patients is higher, and the lighter areas show a lesser frequency of patients. But there's a catch that the data is hospital based, so it does not give an idea of prevalence. But nonetheless, it gives us an idea of where these patients are reporting more to the hospitals and where more care is required. Some other realizations that we had from the registry is the presence of family history. There was presence of family histories on almost 23% of the patients, and it makes us realize that there is great need of strengthening of genetic counseling and carrier screening. And apart from that, consanguinity was very high amongst the amongst the parents of the patients with rare diseases. There was 30% consanguinity seen. And if I compare that to NFHS5 data, it is much higher than the prevalence in India of consanguinity. So again, it makes us realize the need for counseling. So we need better counseling services. Definitive treatment. Only 7% of the patients whom we assessed for this particular particular part, only 7% of them are receiving the definitive treatment, as against 93% who actually require definitive treatment but are not receiving. Diagnostic delays was another important thing that we observed. So, as much as 44% of the patients had diagnostic delay of 1 to 3 years in forming a definitive diagnosis for their illness. And about 7% patients had diagnostic delays of 10 years and above, which is appalling. And there are a lot of reasons which are not unknown to us. So there's lack of knowledge and awareness amongst patients, amongst the healthcare providers. There are geographical barriers which prevent the patients from moving to the healthcare facilities which provide proper services. There are financial barriers with the patients. So all these realizations now the government is understanding, and in a way we have moved forward towards better support of the patients through services, through financial aids and all. So this was just a snippet of the data that we are collecting in the registry, and there's a lot more data which is not presented here. And but we now plan to develop a national rare disease information portal along with the Ministry of Health and Family Welfare, and ICMR is supporting the ministry in developing this rare disease information portal, and it should be live for the public viewing in this year. And I'll just show a few features that we have planned for this portal. So this is the rare disease registry web portal at present. It is login protected, so it is not for public viewing, but we can see the number of cases of the rare diseases centrally at ICMR. This is what we have planned. So a portal will be developed for the rare disease registry and information to the clinicians, to the researchers, to the patients' families, and the policymakers about the number of the rare disease patients, and how many cohorts have been developed for various rare diseases, and from where the rare disease patients are coming. Along with that, we'll have a center locator for all the patients and whoever wishes to get information on where to contact, whom to contact whenever they have rare disease or they have someone known to who has a rare disease. Some important features might be an information portal also, like frequently asked questions on rare diseases for general public will be there. Then information on the institutes which are providing care and how patients can take care of themselves, where to report when they have an emergency. and along with the details of the detailed list of the rare diseases that are being reported under the NPRD, and it will be aligned with the rare disease registry also. So as the diseases get added to the national policy for rare diseases, the diseases will also be added to the registry for information. So this is again a snapshot of information dashboard that is under construction at present. So when prepared, we'll have a very quick and easy access to the data, and it will be helping the policymakers and researchers and whoever wants to know about data on rare diseases. We'll make them available readily. Some of it will be freely available and some on request. This is another snapshot of the data dashboard that we are planning. So how the information portal is helping at present and in the future. So rare disease information portal is important because it brings visibility to the rare disease patients. It identifies the geographical distribution of the patients suffering from rare diseases. It identifies the opportunities for these patients by creating evidence based for needs of diagnosis, treatment, funding, research, counseling, and awarenesses. And then it identifies priority age groups, disorders, geographical areas for various interventions. And we are working on creating rare disease cohorts for clinical trials, testing of treatments and devices. So persistence, perseverance, and resilience is our motto here. And I hope that together with knowledge sharing and our efforts, we can do much more for the rare disease patients. Thank you.